Welcome back to another epidose of these crazy people that just eat meat and can't stop talking about it. Today, Justin and Joe and I have a special guest. We have Dr. Carlo. He came in to talk about his clinic, the Brain Hub. So, Dr. Carlo, tell us a little bit about what you do there.
Good morning, Tom, Justin, and our good friend Joe. Thanks for having me on, and for I guess your listeners taking the time to hear what I have to say. Brain Hub is a clinic, a multidisciplined clinic based in Sydney, Australia. For those who don't know, on the other side of the world, our focus is very much on my elevator pitch. When people ask what I do, it's we help brains work better and to their full potential. And I think it summarizes it. And obviously, there's a lot of detail around that, but that's what we do. Is we help a number of different people with various complex and chronic conditions, including learning and behavioral disorders like autism, ADHD, global delays, and other conditions like post-concussion, dysautonomia, migraines, post-stroke, many conditions that people have just hit the brick wall in finding answers as to how a non-pharmaceutical functional approach can help them. We're a clinic that really focuses on neuroplasticity, the wonderful way that the brain can change given a unique environment in which it's stimulated. We adopt cognitive, emotional, physical, neurological, metabolic, lifestyle approach with our team in helping people. And I think obviously yourselves and your team would know that autism and similar conditions are very much a multidimensional condition that has many different facets to it. So a clinic or a team of people that can adopt an approach to understand these different domains, generally you're going to get better results. And unfortunately, over the last 20 years, we've had some pretty good success as a team to be able to help many people. So in a nutshell, that's Brain Hub and what we do.
Excellent. So how long has Brain Hub been in existence?
So I've been a practitioner for over 20 years now. Brain Hub was the product of it's been around for about 10 years. We've just set up a new dedicated tailor-built clinic just in November last year. And expanding quite rapidly. So the clinic is doing well. We're helping a lot of people, both locally, nationally. We have 50% of patients that see us that come from outside of Sydney. So we have people that come from all parts of Australia, and we actually had our first international, well, actually the second international, one from New Zealand early this year, and we had an American fly in as of mid this week. So yeah, we're getting the word out.
Yeah, I bet it was tough getting people in with the modern pestilence about.
Yes, it's posed its challenges, that's for sure.
So you do most of the work with people in the clinic, or do you do any work with people over the internet or anything like that?
So we've obviously had to adapt over the last 2 years. We have done some telehealth, typically for those people that are already part of our clinic, and we're just maintaining their work. But we're such a hands-on practice that our initial assessments can take 3 to 4 hours sometimes, and sometimes we split that over a couple of sessions. Our diagnostic equipment and tests that we do need the patient here to be able to test. We do brain mapping, or QEG, which you might be familiar with. We do eye movement recording, we do autonomic function testing, we do balance testing, we do a lot of hands-on testing that requires the patient to be here. So once they're here and we've done some work with them, we can maintain their programmed from remote access if required.
Very good. So how big of a team do you have there?
So we've got a team of occupational therapists that do a lot of the hands-on work. All patients come through a system where we evaluate them. We go through their history, all their biological or the neurological markers that indicate brain function. And as I mentioned, eye movements, balance, We do some, we may refer out for some bloods or some genetic testing if we feel that's required, or work with people that can. We're bringing on brain health coaches to evaluate their lifestyle and some of their roadblocks. We have physical therapists, people who can work on their body. So we have a team of people, and that's certainly growing. We'll be bringing on more and more people as we find them.
So how do people typically find you, or you find them?
No, we're fortunate that we don't advertise. We're fortunate we don't need to advertise. Word of mouth from obviously our existing patients that are part of groups, just like Facebook groups or other groups, and they talk and they speak. Fortunately, they speak well of us, so we get a number of people that come through that avenue. We have a lot that come from other practitioners, people that have taken my courses over the years. I'm fortunate that I've been teaching both in Australia and overseas for almost 10 years. So those people that have taken my course and find a sticky patient or a patient that's just not responding, we often see them. We're seeing increases of referrals from medical and sort of the medical professions. And also from social media. We're starting to get a bit of a presence there, although it's not something that I've been grown up in, but I see the value in it, and I see it's a great way that mums and dads and parents and patients can understand what we do from a distance. So it's at this stage, it's coming from those streams.
Yeah, it must be nice not to have a big advertising budget.
Yeah, it's good. Look, we're at the pointy end. Most people come to us only after they've been through many, many different practitioners for many years. And so when they come to us, they've heard of us, they've been, very well recommended by their practitioner to say, okay, look, we've done everything. This is the person now to see. So, people come to us knowing that not necessarily we're the last resort, although in some instances, that's probably what they believe. But really, our point of difference is the amount of time that we spend with patients, both in our assessments, in our explanation of what's going on, but also in our treatments. Our treatments are programs. We have people that stay 1, 2, 3 weeks with us at a time. They fly in, they stay with us. They're in our clinic for multiple hours, multiple sessions per day, every day. Neuroplasticity works by providing the brain and body with the correct amount of dosage frequently. And that doesn't happen by someone popping in once or twice a week or a month or whatever it might be. It's doing it frequently. So our treatment programs are very much geared to providing that ongoing, repetitive, graded, progressive therapy. We have oxygen rooms, we have red light rooms where people can sit in between sessions to boost up that brain again, ready for the next session. So we're geared really for that flow of patients that spend a good amount of time with us, and we hold their hand through that process. So again, we're at that pointy end where people are going, this is different, this is exactly what I need, and I think we do quite a good job at it.
Well, if I can go out on a limb, I can kind of extrapolate a connection with the carnivore diet. A lot of the people that got in it early or came to it of their own before it was popular, they were kind of at the end of their rope. They'd tried everything, they'd been through all kinds of therapy, medications, they tried other diets, and then they wind up eliminating everything but meat and finding that they do better. So you can kind of see a crossover there. So
yeah, look, it's I'm fortunate that I've been involved in research. I completed my PhD last year, and it allows me to dissect where the evidence is, what's BS and what's not. I've been a clinician for over 20 years. So what I read and what I teach others, I put into practice, and I find things, and I'm always taking things in and out of my toolkit in helping people. So, whether it be dietary, whether it be emotional, whether it be a lifestyle, whether it be little hacks like blue light lenses or flashing lights or binaural beats or, vagal nerve stimulators. I mean, we're always constantly evolving what we do and what we use in practice. And it's never fixed. I'm still learning. I'm still taking more courses. I'm still graduating with different degrees and different postgraduate qualifications. And I think I owe it to my patients, but unfortunately, I also enjoy it myself because it's always changing. And there are fads and there are little hip things that people do, but in the end, there's some constant things that we see. And diet is certainly one of those that makes a big difference.
Yeah. So I think part of that too, well, the enthusiasm I hear is that a lot of people like learning new things, right? And it's exciting to come across some sort of new thing that might have been discovered in the lab that you can turn into some sort of practical sort of tool in the real world.
It is, and that translation of knowledge is what it's referred to, is something that I'm passionate about. I did my PhD in a biomedical engineering lab, surrounded by biomedical engineers, no health professionals. So there's a lot of dry, detailed, granular knowledge, but put a patient in front of them who has a disorder or a condition, and it's like they'll talk numbers, they'll talk stats, but they'll forget the person in front. So taking that knowledge and then applying it in a practice when you have, you need empathy for someone who's about to break down because they don't like hearing what they've just heard. And then sort of taking that knowledge and using it to help them is a delicate balance. And it's one that I had to learn. And I actually really enjoyed it. I love the technology. My clinic is filled with, unfortunately, very expensive technology, from neuromodulation units to lasers to all sorts of things that we use. So understanding how to use that, but also, the detail of it, but also be able to apply it to the patient and the person in front of you based on their health concerns and what their goals are, is a skill that not many have, but it's one that I'm always trying to work on.
Did you two want to say something? I don't want to talk over everybody.
Yeah, my first question is, so what was the inspiration to focus on the brain? And it's always very important, but going through your trainings and stuff, you could focus on anything, gut health, heart. A lot of people go into cardiovascular, whatever. So why is the brain so important to you?
I'm the sort of guy that always has questions, and I've taken many technique courses over the years, particularly early on in my career. And what was apparent is that these techniques worked for whichever reason. They help people, and you could see the difference in your practice. But then the question was, either they would ask me, or a medical professional asked me, or I would ask myself, why is that so? Why is that happening? Why is that person improving? Why is this person not improving? So that question of the reasons why led me to try to look for the answers. And the answer in what I found was there's a common thread, and that common thread is neurology. How are things connected? What's the probability of something occurring? And that came down to your certainty and understanding of how one part of the brain connects to another. As I touch someone's hand, what chance is that to have an emotional response, a limbic response, a fight and flight response, a neurological response? Why does someone sweat and not sweat? Why is it that I can have 3 patients in front of me and I touch them equally, or touch each 3 equally, exactly the same way, exactly the same area of the body, but I have 3 different responses? I might have someone who has a hypervigilant response, and they'll jump, and you'll see their pupils dilate, the gut will, they'll start sweating, they'll get cramps, and they'll be hyperventilating. Maybe that person has had a trauma where they were attacked. I might have someone else where I touch their shoulder, the same touch, but they go, oh, that feels so good. Oh, please push harder. And another one that might go, are you touching me? I don't even recognize it. I'm not even I don't feel what you're doing. How can you explain that? The way I explain it, and I think it's clear in evidence, is it's based on their neurology, it's based on their experience. Their experience has dictated what they're likely to experience moving forward. And that's so common with what we see in practice and many patients. Once someone's previous experience and how they're wired up, whether it be genetic or more often epigenetic or a product of their lifestyle, will dictate how they respond to many things in life. It's not the stimulus that was the issue. It's not the car accident. It's not the fall. It's not someone yelling at them in their office or at home. It's based on their experience. And again, to understand that is to understand neurology, to understand how the brain works, to understand how the brain has been wired on what's happened in their life, in their childhood, understanding how a child develops, what milestone they've had, what have they missed, either at birth, post birth, what stresses they had, what dietary issues they had, what infections, whether it be mold or a tick-borne disease or otherwise. How has that influenced their life? And once you understand that, then the pieces of the puzzle start to come together, and you have a far better way to help evaluate and understand and obviously treat someone with these complex and chronic conditions. So I know it's a long way around that, Justin, but I guess I had questions and I wanted them answered. And I went to study more. I thought, what's the best way to understand it, teach it? I then had people question me on my authority and clinic and competency. So I got a PhD, and now I'm running a successful business so I feel that I'm ticking the right boxes in understanding more about what the brain is and how people engage with it.
Joe, did you have anything you want to throw in?
I was just going to ask, I mean, as you know, we talk a lot about diet. People that come into your clinic, into Brain Hub, would you say that have got ADHD or autism? Generally, what is their diet like? I mean, is it what they call a standard American diet? And how does that diet affect them?
Yeah. Look, it's diet is certainly something that, whilst I'm not a dietitian or naturopath, or a functional medicine practitioner, I certainly have picked up things over the years and surround myself with people that do know a lot more about this. Diet is a huge thing, and you're right, Joe. What people come into the office saying, "Oh yeah, my diet's good." Okay, well, let's break that down. Let's have a look at that. And the consumption of alcohol or consumption of sugars, consumption of a very limited diet becomes very obvious once we start unpacking that. So people's understanding of what a normal or a regular diet is pretty appalling, to be honest. We know that particularly with kids on the spectrum and learning issues, we know that they're often fussy eaters, and they're often limited in what they want to eat, or whether it be texture, whether it be smell. So that's a challenge for parents. And look, not for a moment am I certainly empathize with parents in trying to feed their child the right thing, even those that have the right intention, are surrounded by the right people and working with the right groups. Their intention may be exactly what they want or what should be provided, but it's not an easy opportunity sometimes when kids are very fussy. So adults sometimes can be a little better, but we know with adults that, again, their diet can be quite limited and not really wanting to venture out of what they feel comfortable with. I'm certainly an advocate of a high protein, high fat diet. And obviously I'd always caveat that and say to people that it needs to be of a clean source. We certainly, we know that toxins reside in fats. So, eating clean sources of fats, animal products, needs to be from a nice, either organic or grass-fed source. So I certainly advocate that. The brain is very calorie dependent, very fat dependent organ. So, promoting foods, whether it be MCT oils, whether it be animal fats, whether it be eggs, whether it be other forms of protein and fats, is something that are strongly featured in my recommendations to people. Certainly looking at environmental aspects with mold and other environmental stresses is a big thing. And we know that those things can affect the gut and absorption. So it's such a multidisciplined approach. One that I would say to you, Joe, and your team and listeners, is one that often is, and we have people that come to us that have been through the functional medicine route, and their kids have gone through every possible dietary aspect, and in some cases even a carnivore aspect. And sometimes the benefits haven't been as beneficial as one would expect. And not to take away from the diet and what they're doing, but what often people neglect is that there's not just a bottom-up approach to mental health through the gut, but there's also a top-down approach. And that top-down approach is one that I often need to invest some time with the patients, and that often involves that vagus nerve, that the connection between the brain and gut through the vagus nerve or the parasympathetic system is one that's often overlooked, but one that is generally the missing piece. And when you can combine a healthy, balanced brain with a good diet and good gut function, to me, that's the combination that gives the best results, in my opinion.
Yeah, I deal with that question all the time. People are trying to transition diet for both the adult autistics and children. You know, they've been on a very consistent diet of French fries, macaroni and cheese, chicken nuggets,
which they consider a balanced diet. It's got everything.
And they're like, well, how can we get some healthy meat in there and stuff, and texture and appearance, it's always an issue. But yeah, we deal with that a lot. And I was telling them, well, just try it. There's all kinds of possibilities out there, so just keep trying them and find the ones that are appealing and start there. And because a lot of times when people start feeling better, then they're more amicable to trying new things, right? So sometimes you just get that door cracked open, and then they're happy to try new things.
Yeah, definitely. It's interesting that, and I've seen this over and over. Going back to the vagus nerve for the moment, and I hope your listeners may be familiar with it, and I'd certainly encourage them to look into it if they haven't. The vagus nerve is not just a nerve that helps us get into a more rest and digest state, but it does so by helping produce a lot of enzymes in the gut, whether it be pancreatic enzymes or other enzymes, to break down protein, so we don't have abnormal fermentation in the gut, to help peristalsis, which moves food through the gut. It helps close a lot of those tight junctions in the bowel, so we don't get intestinal permeability. It helps repair the gut. So the vagus nerve, which is the nerve that generally helps us slow our heart rate, slow our breath rate, increase blood supply to our brain, puts us more in that restful state, increases gut function and gut breakdown. If you're not in that state, if you're in that fight and flight state, the ability to digest food properly, even though you may ingest food, is going to be limited. So even though you may feed your body with what it needs, the body's only going to take what it can, not necessarily what it wants, but only what it can at times. So really, I know people take in pancreatic enzymes and digestive enzymes, but again, let's look at the underlying cause. And if it's a lack of brain stimulation or a lack of brain function, getting that vagus nerve to engage can have huge effects. People's bowel movements start opening up. They're not getting that putrefaction and in the gut, which can cause intestinal issues and SIBO, or small intestinal bacterial overgrowth issues, which people then say, well, this is what I'm getting. And some may say, oh, well, get off the meat diet because it's causing a lot of this putrefaction. The meat's not the problem. It's the gut that's not breaking it down properly. So vagus nerve therapies is one that we start with all our patients, because invariably they're in that fight and flight state. They're not in that rest and digest and repair state that the body needs to recover. And whether it be, a neurological or neurobehavioral or a psychiatric or a physical issue, getting that gut to work well is vital.
Yeah, it makes a lot of sense.
It's pretty interesting that you put it that way, because for me, before finding carnivore, so I struggled with migraines. I had a decade of chronic severe migraines. And before carnivore, I had done like some spiritual practice stuff, meditation, counseling, cognitive behavioral therapy, et cetera, on my own and while I was going through school. And I felt I had, and the way I explain it to people, because I also coach people in carnivore now. And so they're like, well, how come when you're at the beginning, it was so easy for you to change and you got results so quick and stuff like that, which is kind of true, but everyone's journey is like different. And the way I see it, and I think what you're laying out is that if you do that other internal mental, emotional work, then you add on the physical work. Now you can go from one side to the other or vice versa, but it's like two sides that need to come and meet in the middle. There's the diet, physical work, and then there's the mental, spiritual, emotional work that also needs to get done. And so that's really interesting that I kind of did that on my own, and it's like a 10-year journey or maybe more, and continues. And so, you know, we're not typically doing pilgrimages, and you know, I don't think you have therapists working for you and things like that. Because you mentioned like trauma and, you know, different work like that. So like, are you referring out for things like that, or when you do find out someone had some kind of trauma, or how does your team approach that, I guess?
Yeah, look, trauma's an interesting one. If you know, we need to be very, I'm not a psychiatrist or psychologist. So when I feel that someone requires some specific attention in that area, I'll certainly refer them out for co-management. It's interesting because depending on the severity, and obviously if there's self-harm components to that, or I feel after a trial of therapy or care that there's a lot of emotional blocks, then that's when we put pause on things and say, okay, look, you know what, we need this addressed now. But what I often find is that, and I think, Tom, you mentioned this earlier, about if we can get some momentum, or if we tick things over in the right manner, if we get the brain to engage where they're starting to think clearer, they're starting to sleep better, they're starting to eat better, the requirement for someone external becomes less and less, because the brain has that innate capacity to get better and do well. We're all built that way. We just get in the way of, you know, we self-sabotage ourselves more than anything else. So if we can remove some of those barriers that stops people from to heal themselves, then you'd be surprised at sort of the capacity that they have. That being said, though, if I do feel that there's a roadblock that I can't overcome, or attention is required, then I'll be the first to say we need to get some co-management here. And I think that's an important thing. And that, whether it be it's sometimes pharmaceutical interventions are required, sometimes counseling, sometimes more marriage counseling is required. There's many things that I know. I know what I'm good at, and I know where my expertise doesn't lie. But I think
kind of a left field. A family comes in, hey, treat my son or daughter, and then, you know, some marriage counseling. I mean, that conversation just does not sound easy to have with them, you know. But no, absolutely, it makes sense though, with the couple being very tumultuous or high strung and things like that, having that's the environment, right? The younger the child, the more the environment is the parent-child, parent-sibling relationship.
Incredibly important. And we make it a requirement that parents are engaged with their child's therapy and care. Not only do we do intensives in our programs within our office, but at some stage there's going to be homework to do. There's going to be home-based therapy, and it's not left to the child's volition. It's very much with parent guidance. So we get, we find that a father figure, whether it be the father or an older brother or an uncle or a next door neighbor, a male figure involved in a child's care is critical in our opinion. I think there's some good psychological and social engagement studies that show that male peer to be very important with helping kids, particularly younger boys, go through care. So there's an interesting dynamic there. And again, it's not my area of expertise. I see it and I can identify when something's not right. And I'll plant some seeds. But if I feel that any further time is required, again, we have a brain health coach on our team that can address that. We can refer out to marriage or counseling or psychologists that could do further work in that area. So, I need to be across where and what people require as part of their journey.
When you were talking about the vagus nerve, there was something you said that kind of struck a chord with me, because you're kind of talking about the body being in the right state, let's say to digest. You don't really want to be in the fight or flight state, right? When you're trying to digest a meal. And I'm always having conversations with people about, working out. I like the weight lifts. That's kind of my thing. And I have having discussions with people. They think they need to limber up every joint as loose as possible. And that's what warming up is. And to me, it's really about letting the nervous system know what you're doing, that you're going to do a task, but this isn't life or death. This is just an activity, right? And I think that makes a big difference in getting through a workout and recovering from it. Because if you go into it in the fight or flight sort of state, it generally doesn't go well, because you burn out a lot faster and you don't seem to recover as well, right?
Yeah, certainly. Yeah. Your body goes through, in my opinion, I think you're in some ways setting yourself up for injuries at times. Your body awareness becomes reduced. And if your body awareness is reduced, your reaction time, your ability to respond to different environments can become compromised. That being said, that we know that fight and flight puts you in a heightened state of alertness, and it's there to help you survive, not necessarily thrive.
Right.
So you need to be able to, I mean, there's a time and place when you want to be pumped up, you want to be ready to go, you want to be, if you want to lift a certain weight, being too restful and chilled out may not be the best thing for you. But by and large, if you can balance your therapy, your sessions with a bit of the relax and the stretching to the more intensity to the more recovery, you can go through that. I mean, this is why people do ice baths and do those compressions or other forms of therapy where they put their body back into that reparative state. So cryotherapy is a great example of that. Anyone needs to just follow the Wim Hof method as a way of getting the body to recover post physical exercise. So there's different ways and there's different approaches. I'm not necessarily advocating one over the other, but I think having a balance, listening to your body, looking at functional indicators that tell you where you're at. So whether it be things like heart rate, whether it be things like flexibility, whether it be things like sensitivity, they're all measures to say, where am I at? What can I do? What should I be doing next? And I think working with someone, whether it be a trainer or a therapist or a practitioner, that can understand that physiology, I think is an exciting area.
Yeah, and if I can, I want to pick your brain about the brain one more time. So I'm always having discussions with people too about autistic brains in general. It's because typically when you see an MRI of an autistic brain, it's structurally different, and the difference in structure often explains why they tend to be more sensitive to light or sound or tactile input and so on and so forth. The flip side of that is that just about everybody's brain is constantly rewiring itself, right? So even though a typical autistic person may have a larger pathway between, say, the ear and the brain, so they're really sensitive to noise, when it comes to overcoming problems or just improving development, there's typically is still quite a bit of capacity to improve just by rewiring the brain with some sort of therapy or activity or so on and so forth, right?
Exactly. I think you said that really well. There are both structural and there are functional differences. So when we do more functional imaging, like SPECT scan, like functional MRI, like DTI, which is diffusion tensor imaging, where you see these wonderful tracts that connect different parts of the brain. You might see these images of the brain and you see these colorful tracts that connect one region to another. There's clearly a difference when you analyze. The studies have shown this. There's certainly an anatomical and a functional difference between a neurotypical and an autistic brain. And there are strengths and there are weaknesses. We know that an autistic brain, there are extraordinary strengths that they can have and capacities.
For sure.
But that's offset by significant deprivation or dysfunction or lower function, or however you want to describe it.
Right.
And it's that disparity between hyper and hypo that really sets us apart, or sets that cohort of people apart. And that's what looks so, why they function so different, is because they have such differences between these areas. So nowadays, autism, the way I look at it, and my mentor and train and people that I've learned from, look at autism and similar conditions as a functional disconnection syndrome, where parts of the brain, they're there. We know that they're not missing almost all the time. They're never missing, but there's a disconnection between these areas. There's some short range and long range connections that have not developed properly or have overdeveloped. And so you get these savant cases where you get extraordinary capacities, and then you get the non-verbal aspects, or you get the processing issues. And we see, going back to your point about processing, we see with sensory processing, whether it be visual, auditory, touch, smell, taste, the senses themselves are actually, I mean, if you test someone's hearing, if you test the nerve that connects the tongue to the brain or the eyes to the brain, it's there. It's not that it's missing. It's what the brain does with that. That's where the challenge is. And really, they may have missed a milestone. They may have missed, or milestones, and that part of the brain just hasn't connected or developed to other areas. And you put something in front of an autistic child like an essential oil, and they won't even have the capacity to inhale. And I'm talking more regarding kids than adults. Just the ability to inhale and then to understand what that is and process. Well, that's what that means, or that's my previous experience of that. And so that's all a lot of times either missing or just hasn't developed appropriately. So we take the approach of assessing that, because if you can't assess that imbalance or neurodevelopmental milestones through the assessment of primitive reflexes and similar types of stages of development, then you really are not understanding how that brain has developed or poorly developed through life. So our approach is always along those lines. And once you can identify that, then you can say, well, here's a remediation or a therapy program to help rebalance that dysfunction. And we take that approach, and by doing so, we just, parts of the brain just wake up and they start feeling things. They start feeling pain, which, parents sometimes say to me, oh, my child's feeling pain. I go, that's great. They're feeling hunger. That's great. Oh, he's eating the fridge out. That's awesome. He's now getting in touch. He or she's now being in touch with the body and fueling the brain with the calories and the food that it requires. So there's sometimes we just get to set the expectations for parents to say, well, this is what's going to happen. There's going to be some behavioral and social changes because the brain is now engaging and now it needs to catch up to what it's missed over the years.
Very good. Yeah. What about people who are overly sensitive to light and sound and tactile input. What type of resources are there out there for people like that?
Yeah, it's a very common cluster of symptoms, and we don't just see it in those with autism or behavioral issues, but migraine sufferers, someone with chronic dizziness, someone with post-concussion, those that have got like fibromyalgia, dysautonomia or POTS, which is postural orthostatic tachycardia syndrome. There's so many different conditions that have sensory sensitivities as part of their symptom cluster. And what we often find with a lot of these people is that the brainstem, which is this lower, more primitive part of the brain, its job is really, it's the first relay station where sensory information from my ears, my eyes, my taste, and from my body go into. And this primitive part of the brain helps make sense of what it means. And for many conditions, that brainstem is overly sensitive or sensitized, more commonly referred to as. And when it's sensitized, it takes a smaller amount of input to piss it off or get it or have it aggravated. And when it gets sensitized, light, noise that would otherwise be tolerated becomes, steps over that threshold, and the brain goes, okay, bugger off, it's too much. And then it goes back into that fight and flight mode. Blood moves away from higher cognitive, higher executive functions to more of a get me out of here, I need to just survive mode. So we see that. Now, there are many ways in which we can, first you need to identify it, but once you do, you need to manage it. And there's generally two approaches. One, there is filter those inputs. So the brain has a more muted input, but also increase the function of the higher areas of the brain so it dampens these unwanted responses. So to give you an example, we might use blue light filters. We might use certain smells. We might use binaural sounds. We might gently stimulate the face or the trigeminal nerve. We might do some tongue stimulation. We might do some gentle movement exercises to help stimulate the vestibular system, and many others. Might work on the upper cervical spine, might work on the jaw. All of these areas can influence that brainstem. And if we can influence it at the right measure, the sensitivity response reduces. And we see people with migraines, you can do work on the jaw, you can do work on the neck, you can get someone to listen to soothing sounds. You can stimulate the vagus nerve. All these things are known to help reduce that brainstem sensitivity, and so they're less sensitive to these senses. At the same time, if you can get that frontal part of the brain to engage through cognitive exercises, general mood exercises, and again, many other things, it puts a brake on the output of that brainstem. So you get a two-prong attack. You get the filtration and you get the suppression that occurs from a top down. And together we see great results with people with post-concussion, migraine sufferers, and those with neurobehavioral conditions as well.
Very encouraging.
So when it comes to the migraine, you do, what the process you just, are you able to reduce the migraine in its tracks? Now I understand you're probably reducing over time as well. Because I mean, man, if there was some, I remember when mine were really bad, like it just seemed like they were a freight train or like a rocket that once it's lit up, and buy the ticket, take the ride, you're just on your way. So are you actually able to kind of teach them to interrupt the migraine in the middle of a migraine, if that makes sense?
Yeah, no, it is. We've had success on different levels. Obviously, as a prophylactic or as a preventative, we also see it for those that actually are experiencing a migraine, that if they can venture into the clinic, which may not be easy, driving and so on. So those that can make it in, we know that we can ablate or certainly reduce the severity with what we do. There's no question about it. We can use high concentration oxygen. We can use red light. We're doing things that are very graded to where they're at. So we're not spinning them around too much. We're not doing a lot of things that,
Right.
you know, we're going to need a bucket close by. So we can certainly knock that intensity down where they're walking out going, wow, you know what, I feel a lot better. We also teach them little hacks that they could use at home. Ice washes, ice baths, certain lenses, certainly dietary and supplements can help. Breathing and mindfulness practice. You know, there's many things that, and look, it's never the same. You know, we've got a big toolkit that we start with. What works for the person takes a little bit of time and trial, but also from our assessments, from our detailed assessments, we'll have a very good idea to say, these are your triggers. This is how your brain is wired. This is what I believe would be your best go-to therapies to prevent and to reduce the severity of your migraine once you have them. So yeah, look, it's not a you know, lie in a dark room and hope for the best. We can be proactive, and there's great studies that have shown vagal nerve stimulation to reduce the severity of ictal migraine. So when they're experiencing a migraine, to reduce the both severity and the duration of the migraine whilst it's actually happening. So it's not a forget about it. I know most people would probably want to just do that, but if you've got a few tools in your, you know, ready at your disposal at home, then there are a number of things that you can do that can really wind it down.
Would you say that people that have terrible sleep are more susceptible to migraines?
Yeah, look, if I go through our detailed history and we look at what are the common traits with someone with migraine and the chronic persistent migraines, what are the common traits they have that many people do? There's a couple of things. One, a history of migraines. So generally in their teenage years, a family history of migraines, a history of concussion, a history of fear, anxiety, or depression, or hypervigilance, a history of some neurobehavioral issues. So as a child, maybe on the spectrum, Asperger's, attention issues. Now, these aren't always the case. I'm just, if I had to.
Well, I think I'm at least 5 for 5 or 4 for 5 that you've listed already. I have the concussions. I had the family history. I had the not that the teenage one was the one that wasn't, although I would get really bad sinus issues and like sinus headaches. So maybe those were migraines. I don't know. No one's ever able to piece that together, but everything else you listed was me 100% so far, except for like one. So yeah, definitely checks out.
So we go through that, and it's consistent. You know, these things don't just happen randomly. And if they do, and they're extraordinarily painful without any other comorbidity or other indicator, that's actually not a good sign. That's generally where we need to get an MRI or something else. Something else is occurring more often than not. But typically you see this pattern. And go back to your point, Joe, when we look at their lifestyle, certainly dietary, environmental, familial stress, sleep, are almost always involved, and why you need an approach that addresses that, and why I keep getting so disappointed, although I shouldn't be surprised, when someone says to me, they've got all of this and their doctor has given them Botox, or the doctor has given them some anti-migraine medication. I'm thinking, and how's that addressing any of the things that we've just identified? It's not. Well, what are you expecting? So, you know, look, I know there's a place for medication. I'm not here necessarily to say I'm anti it, whilst I am. But there's a time and place for it. But it's too often, too frequently used as a way to treat conditions where it's not the answer. It's not the answer for these people. So, you know, so I had to get that off my chest, because it's
well, let me just say,
you guys see it.
I mean, I'm surrounded by people that are trying to get off medications that eventually cause worse problems than they solved, so I think we're all leery about at least taking medications long term, right?
Sure.
Yeah.
But I mean, we
Look,
see with within the low carb carnivore community, people that are have diabetes, and instead of the doctor telling them, listen, maybe you need to correct your diet and your sleep, they give them medication.
Yeah.
Because it's just the easy way out. Instead of them spending half an hour, 40 minutes with their patient, they just need to write a script and say, see you later, bye.
It's a system that is set up for emergency care, one that gets people out of the emergency department, but it's not there for health care. It's
Sorry
not there.
about
Yes,
that.
someone else agrees with me. It's certainly not there for health care, particularly long term. So whilst I support people in having an emergency kit in their pocket or their bag when they have these episodes, but they should always be looking towards ways in which they can improve their lifestyle. And Joe, you mentioned some good points about blood sugar. Blood sugar, inflammatory status, autoimmune status are massive with any brain-related condition, from neurobehavioral to injury to neurodegenerative. So if someone's, and as part of our initial intake is we look at their, we ask questions and we look at some of the labs that look at blood sugar, thyroid, iron carrying capacity. So if the brain needs fuel, oxygen, and stimulation, and if the fuel supply is spiky with a poor sugar and insulin mix, they're not getting the micro and macronutrients they need. They're not getting the oxygen that they require through being anemic or poor chest sort of use or diaphragmatic use, and they're not stimulating their body effectively through exercise or mindfulness practice or otherwise, then the brain's really not going to be in a happy place. So the practice or practitioner that can observe, recommend a series and a broad approach is really one that's going to have the best outcomes, in my opinion.
Yeah, I was just going to say, I live in the inner west of Sydney, about 15 minutes out of the centre of Sydney. And you see a lot of beggars on the side of the road, and they've always seemed to have, they've got mental health issues, or you see them walking up and down the street, and they never have a bottle of water with them. They've always got the big bottles of Coke. Or lemonade. And it's always a big bottle of sugary drinks, and they're just sitting there talking to themselves, So yeah, it's a big issue.
It's a big issue. I know the argument. Some people's argument is a cost, and well, it's cheap. It's cheap to get McDonald's. It's cheap to get a loaf of white bread. I certainly would argue against that. I think there are opportunities where you can have a high protein, high fat diet that is relatively inexpensive, and getting all the things that you need. So, working with people, being educated, joining your group and understanding more about how people can understand what you do, I think is a great way forward.
All right.
Yeah, we've all been tracking our sleep, and we noticed something interesting, and maybe you can shine some light on this, or maybe what you've seen. So it's interesting because so me and Tom do the Fitbit, and Joe just got a device that does it as well, that tracks your sleep. Right. And what we noticed right away is that me and Tom wake up, like me especially, I'm waking up like a bunch of different, like I'm not fully conscious, but like, it ticks it off, you know what I mean? And it'll be like, it'll say like I've slept for, or my deep sleep will be like an hour and a half, and it'll be like, but I spent like an hour and 12 minutes awake. You know what I mean? And then Joe, like he was telling us his numbers, and I was tripping out because Joe's
like a rock.
Yeah, like he doesn't wake up at all. He sleeps less overall, it seems, like hour-wise, but it seems like he actually spends his time asleep, whereas me, and to a lesser extent Tom, but I think we're kind of neck and neck. we're busy at night. So does that say anything about us? Like if,
But hang
if
on,
there's
hang on.
anything.
I work at night. You know what I mean? So,
That's true. He gets off late, so
Well,
you know,
I think
I get home, I get to bed sometimes midnight, you know, because I've just finished work.
I think the answer is obvious. Joe's been under my care for a number of years, so I mean, I don't know what else to say to that. Look, sleep is a really important one to reboot, and having, there's sleep hygiene. There's things that you should and shouldn't be doing before you go to bed. There's and I certainly advocate that there is practice of whether being grateful and having gratitude of the day and what you've done. There is as much physical, emotional, cuddle time with your partner can be good. There's practices of listening to binaural sounds, which I'm a big fan of. There's many things that you can use. There's intake of food over a certain period of time. There's certain foods that you should and shouldn't be ingesting. There's supplements that you could be taking there. So there's no one rule. I find it is a bit of a trial and error, but it's one that unless you can measure it, like using a sleep tracking device, and you can diarize what you've done during the day before the sleep, and seeing what result that had is really important. So having a diary, making note of it, trialing different things, measuring your sleep, following some good sleep hygiene practice. Some people I'm a morning person. So, by 10 o'clock, 9:30, I'm ready for bed, but I get up early. And I have a pretty good quality sleep during that time. Going to bed, packing away what you've done during the day is really important. I don't go to bed thinking about what I need to do the next day. It's ticked off. I wake up and I'm ready to go. So
that's impossible.
Well, I just sit there and look. I've got a lot to be grateful for in my life. So I do take a moment to go, look, this is great. I've achieved this today, and this is ready for tomorrow. I know that if I've got something on my mind, I will wake up and I'll normally get out of bed and at 2 a.m. in the morning and go ahead and do it, and it disturbs my day. So everything works different for different people, but definitely trying to understand and acknowledge where your sleep is, and then trying to vary it is such an important process.
Now,
I'm going to make my girlfriend watch that part about how cuddle time was significant. So
Cuddle time is important.
make sure and write down what time that was.
I was going to say, I mean, for me, it's very hard, just to get home and switch off. I'm always thinking.
Yeah.
No, I don't know if it's an Aspie trait, Tom. I'm always thinking, not for tomorrow, but for the next 6 months. And thinking, and I'll go to bed, and I'm lying there, and I'm about to fall asleep, and all of a sudden, a song pops in my head, and that's it. And I start racking my brain out, and I've got to start thinking. And until I find out what the name of that song was or where I heard it, or that. But so it's very hard for my brain to switch off.
Yeah. Well, once you do, though, it seems that like you're off, though. That's the part that surprises me.
He's only had that watch. He's only had that watch a few days. We don't have all the data yet. I know how Joe is when he gets his 90s flashbacks. He'll be up all night texting me and calling in requests to the DJ.
Hey, I'm just trying to have a little bit of competition. I'm trying to figure out which one of our brains is more broken. I don't know. I'm either going to win and lose or lose and win. So there we go.
I'm pretty sure mine's not as broken as yours. I've known you a while.
Probably not.
Actually, just going back to the beginning of the show where you mentioned glasses, the blue lens glasses, or blue blockers, I think they're called. Blue light blockers, yeah. What are your thoughts on them? Are they important? Are they good to use before you go to bed? If you are on a device, or watching TV? They're a tool. They're a tool that can work. There you go, Tom. They're a tool that can be hugely important for some and minimal for others. It makes sense. Blue light, we know, can certainly disrupt your circadian rhythm. It stimulates that brainstem that we're trying to sedate and filter. So I instruct people a couple of things. One,
minimize your device use after a certain period of time, whether it be 9 o'clock or otherwise. Put your device in night mode. So almost all devices now, computers, phones, have got a night mode. So it's not a brightness mode, it's a blue light mode.
Yeah, it's color shift.
Color shift. There's different devices have called it different things. On your laptops, PC or Macs, you can download apps that can put the computer in that mode.
I'm pretty sure it's built into all the operating systems now.
I think
popular.
Yeah, exactly. And I think even like TVs and external monitors now, they're almost part of it as well. And then I look at lighting in the room. So rather than the white light, I suggest people look at the warm light. Maybe look at indirect light, warm indirect light. Maybe a salt lamp in the room. It emits that warm light, and this is really for the night. Again, to prepare yourself for night. And maybe even blue light filter glasses at night. Now, if you're doing those other things, the blue light filters are probably not necessary. Certainly during the day when you're sitting in front of a desk or you're out under fluorescence or white light, those blue light glasses can be very helpful. So I normally advocate them. I have patients that absolutely swear by them and others that say it makes some difference. It's a low cost option that I think is very good bang for buck for most people.
Is it something that in your clinic you can test for whether someone needs them or not?
Yeah. So we've got a range of them in our office, and I'll put them on, and you can test. So with most things that we do, there's normally a pre and a post test, and the pre-test might be, let's just say, a good example is I might shine a light in their eye, or I might do a convergence test where I'm placing my finger out and I'm bringing it close to their nose, and their eyes have to track inwards. Now, someone on the spectrum or someone with post-concussion or a migraine sufferer will dislike convergence and light shine in their eye, right? So that's my pre-test. I'll put the glasses on and retest. And sometimes even before I test, I put the glasses on and they'll go, oh, wow. Oh, whew, that feels better. And I might put a pulse oximeter on their finger and I'm measuring their heart rate and their blood oxygen saturation, oxygen saturation. And you'll see figures change. You'll see them go, oh, that feels better. Or they'll go, oh, no, take that off. Straight away, you put it on them and they'll take it off going, that's not for me. And if they can tolerate it, I'll do my finger to nose test. I'll do my shine the light in the eye test. I'll look for their heart rate. And if I see that they can tolerate those and the heart rate drops better, I've just done a very tailored assessment on that person to say those glasses are suitable for that person. Now, that's the easiest way. And again, if someone doesn't take the time to test that and they're just buying something off the shelf without knowing whether it's good or not good because someone else has used it, you could be lucky or you could be just wasting some money.
Yeah,
I think we need to do that test next time I see you.
Definitely.
Our friend Janice, she went and had the Earland syndrome test done, and she has glasses, and it makes a huge difference for her. She's been encouraging me to do it because, like, just reading and stuff like that, she can read really fast when she wears the glasses, right? So apparently there's people that have dyslexia or dyslexic like symptoms, and just by filtering the light, it kind of mediates those symptoms.
So that from our experience, dyslexic patients tend to work best with red colored lenses or rose colored lenses. And those with attention and spectrum issues tend to work best with blue colored lenses. Now, that's not a blanket recommendation for everyone, but that's from our experience. We seem to find that works best. And again, we test it. We put it on and we see what's their behavior, what are their markers of function, are we seeing an improvement or not? And if not, change it. If we are, great, that could be something that works for them.
So what happens if you have
Dang,
both
I need to find
issues?
some. Yeah, I was gonna say I need some purple glasses. Is what I was gonna say.
One blue, one
Yeah.
red.
Yeah.
Well, you can get what we call hemifield glasses, where you have red on one side and blue on the other side. Now it's so each lens, you get half of each lens. So on one side it's blue, and on the other half it's red.
Wow.
And you can actually reverse them around as well. So
it's-
you can get funky with these things.
Yeah.
It's pretty cool. It's like, look, people who use Erlen lenses, I mean, that's another level. And they're generally optometrists that do that, and that's great. Again, that's just that last little bit of fine tuning that works well for some people.
I was going to say it's like wearing those old the 3D glasses at the cinemas, the paper ones that were blue and red lens.
Potentially.
Mhm. All right. Well, I don't want to keep Dr. Carlo too long. Do you guys have any more questions?
I just kind of want, so, obviously most of our American listeners, unfortunately, may not be able to afford that plane ticket to your clinic. Are there a tip or do you have references out here in the United States? Or if you're like, okay, if this is the one thing, I know it's so hard to pick out, or like 3 things, maybe to get that vagus nerve to like chill out a little bit, just something that people can take home and put in their pocket or in their brain.
Yeah, look, there are a couple things that if I had a priority of where people should invest their energies, certainly vagal nerve therapies. And I know that could be pigeonholed to just stimulating a nerve, but there are many ways to do that are more holistic. And I think, so that'd be one way. The other is primitive reflexes. We haven't sort of spoken much about that. Primitive reflexes are these reflexes that we're born with as babies and as infants, and by the age of 1 to 2, they transition, or they're there to help protect our brain and body when our brain hasn't developed properly. So they're very primitive in their action, like grasping and feeding and startle. But past the age of 6, 12 months and more, we shouldn't have these reflexes obvious. But almost every person with a neurobehavioral, a neurodegenerative condition, we see the retention of these primitive reflexes beyond the normal age, but beyond the age in which they should be obvious. And so the integration and the inhibition of these reflexes is critical to have that brain able to learn and develop and take on therapies. So finding a practitioner that does primitive reflex therapy is critical. And
I've never even heard that term before, so I'm definitely going to do some research into that.
Look, primitive reflex therapy is one that it's such a foundational aspect to. They're very stereotypical. They basically, when they're still. I'll step back for a second. So we're born with these reflexes to help our brain survive and our body survive. They're there in the absence of a fully functioning, developed higher area of our brain. We're dependent on these reflexes, and obviously we're dependent upon our caregivers and parents to survive. But 6 months, 12 months of life, we're learning, we're observing, we're trialing things, and we're starting to understand what we should and shouldn't be doing, how we can survive. And as our brain develops, it suppresses these primitive reflexes which sit in our brainstem. But for many people, particularly those on the spectrum, these reflexes, for many reasons, are still very prominent. And so rather than functioning at a point where we've got cognition, we can make better choices in our life, we can integrate and process things better, we respond, our behavioral, our social, our physical, our neurological responses are very reflex-based. So if I clap a loud sound, or if I shine a light in someone's eye, they will respond like they're in that fear response, or what we call the Moro reflex. Moro reflex is one of the most important primitive reflex. It's that startle response that we see in kids. But we see this in adults and teenagers and adolescents with learning and behavioral issues. So the retention of these reflexes beyond a certain age is not ideal, and we see them carry on through. So finding a therapist that can help integrate these reflexes, and there's many ways in which we can do that, is critical. So maybe we can leave another talk of primitive reflexes, but certainly primitive reflex therapy, vagus nerve balance, and I'd say movement, physical movement that involves vestibular or head movement, spinning, body awareness, core strength exercises are really important, because that gives our brain an understanding of where the body is relative to space and where space is relative to our body. And having that connection, having that little GPS system orientate itself properly to others, social and emotionally and physically, is really important. So physical movement, vagus nerve activity, and primitive reflex therapy will be the top three things. I mean, look, I say that, but there's a lot of detail in each of those, as you can appreciate. And I'm certainly to help, for those who are based in the States or elsewhere. I've got a good network of practitioners and friends based in the States that I connect with frequently, that I can put them in contact with. I'm fortunate that I go to the States probably every couple of months to attend lectures and to assist in lectures. So there's opportunities. So probably for people to reach out to me through an email, and I best can direct them where they can get some help with a network of people that I have in the States.
And which would be the best way to contact you?
So
those that are
my email is Carlo, so CARLO at BrainHub, one word, BrainHub.com.au. So that's my email address that people can contact me at any time. If people want to know more about what I do in our clinic, www.brainhub.com.au, and they can understand more of the services that we provide. So yeah, they're probably the two best ways, and obviously through all the social media, through Instagram and Facebook and Twitter as well. So yeah.
Excellent. Yeah, I'll try and put the
Awesome.
links in the show notes for people. So
Thanks, Tom.
all right, so we wrap it up, because I know we could talk all day. Yeah.
You have to come back on.
We can always have you
100%.
back. I'd love
Yeah,
to
I'd
have
love
you.
to. Anytime.
I'm sure there's lots we could talk about.
Thank you.
Anyways,
That's fantastic.
as we always say, please like the video, subscribe to the channel, pass links on to people who might enjoy it or benefit from it. And until next time, eat some meat, feel better.
Feel better.
Whatever you
You
do,
do.
don't fall
Don't
down.
fall down the
The carb hole.